So hello friends, welcome back to my channel Medicine 101. Today we'll talk about mitral stenosis. Okay, so before going to the topic, let's talk about the terms. There are some terminologies that should be cleared. Okay, so where can we see the stenosis? Whenever we see the problem at the valvular levels. Okay, whenever we get the problem at the valvular level, at the time we'll see this type of the problem. Now, whenever we are talking in terms of the valvular heart disease, when you are talking in terms of valvular heart disease, okay. See, in these cases, we will get two types of the problem. One is stenosis, another will get regurgitations. One will get what? Stenosis, another will get regurgitations. Now let's talk about them. Now, whenever we are talking about stenosis, and for example, we are talking in terms of regurgitation. Regurgitation, okay. Now see, when you are talking in terms of the stenosis means whenever we will see the valve is not completely opened. Okay, so we will not see the complete opening of the valve. That means the valve that will open partially. So partial opening of the valve. In this case, whatever the problem we will see, there will be partial opening of valve. Partial opening of valve. Okay. If you talk in terms of the mitral valve, then it will be partial opening of the mitral valve. If you talk in terms of the tricuspid valve, then you have to write it over partial opening of the tricuspid valve. Now, whatever the problem we'll see over here, let's see. For example, I am drawing the left heart over here, just like this. Okay, is the mitral valve. Now see. What do you know? Whenever the ventricle that will go under the relaxation conditions, whenever the ventricle that will go under the relaxation conditions, just like this, when you will see the ventricular diastole, at that time, what do we know? The blood that is supposed to come from the atria to the ventricles. This is the aortic valve. Okay, now see. The blood that will come from what? From the aorta, from the atrium to the ventricles over here. Okay, but if you see, if the valve is not open completely, if you see the partial opening of the valve, just like this, then whatever the problem we will see, there will be a problem in the what? Forward flow of the. There will be problem in the forward flow of the valve. Okay, for example, if this type of the problem is not here, if the valve is okay, as you know, this type of the retardation just like this. Okay, see, if we see there is normal valve, then the blood there will come completely. Because whenever the valve is open completely, there will be no problem in the blood flow, forward blood flow. But whenever we are talking in terms of the stenosis, at the time the partial opening of the valve, so whenever we will see the partial opening of the valve, at that time there will be problem in the forward blood flow. Okay, for example, from here, from the atrium to the ventricle. So in these cases we will see what? Forward blood flow that will be inhibited. Okay, very little amount of the blood that will come. Rather we will see in this case the blood that will there will see the backward flow of the blood. We will see the little amount of the blood is coming over here, and we will see the blood whatever it will come out. We will see the backflow of the blood in this case. Okay. Now, what about the regurgitations? In the regurgitations, we will see the opposite things. Okay, that means here what? The partial opening of the valve. Here we will see there will be partial closure of the valve. That means the valve that will be not completely closed. So we will see the partial closure of the valve. So let me write it over here. That we will see in these cases that partial closure of valve. Okay. Let me give you the examples. For example, see, if we see normally just like this, whenever this is going, that means the ventricle is going under the contractions process, that means in the systole. At that time, what we will see, the blood, there is a chances for the blood to go what? From the ventricles to the atrium. That means there is a chances the blood will go normally where? From the ventricles to the aorta, but there is chances, okay, for the blood flow from the what? From the ventricles to the atrium. Now, if the valve, normally what do we know? The valve will will close completely. The valve will get closed completely under normal circumstances. But whenever we will see there is partial closure of the valve, that means the valve is not closed completely at the time. From this portion, the blood, there is chances for the blood to go backward. That means from the ventricles to the atrium. So in these cases we will see that is known as regurgitations. Okay. So we'll see backward blood flow. In this case, we'll see the backward blood flow, just like this. Now, in some individuals, we can see the mitral valve stenosis. Some individuals, we can see the mitral valve regurgitations, and it may be also happen that we can see the stenosis and the regurgitations in only individuals. So that means we can say the persons can have mitral valve regurgitations, and the persons can have also the mitral valve stenosis simultaneously. Okay, you can see the both of these things together. How? For example, let me show over here. If we see the mitral valve that is getting calcified over here, okay, for whatever the reasons, if we see the if you see the calcified valve over here or the fibrotic valve over here, as a result, if we let me write it over a calcified valve. Whenever it will get calcified, the rest of the way it will be what fibrotic in nature. Fibrotic in nature. Now, in these cases, we will see this type of the valve. They will neither they will be not able to complete closely. That means there will be not there will be whatever the thing will see the partial opening of the valve, along with that we will see partial closure of the valve. That means this valve neither it will be able to open completely nor it will be able to close completely. That means we will see the partial opening of the valve and the partial closure of the valve. In these cases, we will see both of these things in terms of the calcified valve. Now we'll talk about in details of the mitral valve stenosis. Okay, so this was all about the normal introductions, because just to describe the term stenosis and the regurgitations, and just to differentiate them, I just mentioned these things over here. Now, if we just talk about in terms of, for example, in terms of the aortic valve over here, let me show. If we talk about in terms of the aortic valve, see, just like this. Okay, now whenever the ventricle is going under the contraction process, whenever the ventricle that is going under the what? Systole, if you see the ventricular systole, at that time, whatever the thing will see, ventricular systole, okay, whatever the thing will see, the blood is supposed to go from where? From the ventricle to the aorta. But if you see this valve is not, see, try to understand from these things. If you see this valve is not able to open completely, if this valve is not able to open completely, as a result we will see there is a chances for the backflow. That means we can see the regurgitations. You can see the regurgitations. Now see, when you will see in terms of the ventricular systole, you can see the regurgitation. Okay. Now think about whenever let me show in this portion. Now see, whenever the ventricle is under the relaxation condition, that means we are seeing the diastole of the ventricles over here. As a result, what do we know? There is a chances, because after the diastole, the pressures within the aorta, that will be much more greater than the ventricular pressures. Now, when there is a chances for the backflow of the blood from the what? From the aorta to the ventricles. Now, if you see this valve is not closed completely, if you see this valve is not closed completely, then whatever the problem we will see, there is a chances for the what? Backward flow, just like this. Okay. There is a chances for the backward flow. Now we'll talk about in terms of details about the mitral valve stenosis. Okay, so we'll see whatever the thing we'll see over here. Okay, whenever we are seeing this valve is not able to open completely, we'll see what? Not regurgitations. We'll see over here the stenosis, and we'll get over here the regurgitations, because we're getting the backward flow. In the same direction it is coming, it will be stenosis, and it will be what? It will be over here regurgitation. Okay, just like this. Now it was my mistake over here. Okay, sorry for that. When you see where I'm repeating once, so whenever the ventricle is undergoing the systole, or that means contractions, at that time that the blood is supposed to go from the ventricles to the aorta. But if you see that the partial opening of the valve, aortic valve, then there is chances of the blood to go in the same direction. That means there will be problem in the forward flow. And whenever there will be problem in the forward flow, then whatever the thing we will see, that is known as the stenosis. That means we will see our aortic stenosis over here. And whenever we will see in terms of the That means the whenever the valve is supposed to be closed, at the time if it is not closed, then there is a chances for the blood to go from the outer to the ventricles, and that is known as regurgitation. That means the backflow. Okay, just try to correct it. Now we'll talk about in details in the mitral stenosis over here. Talk about in details mitral stenosis. Now let's talk about the mitral stenosis. Now, what are the etiologies or the positive things in terms of the mitral stenosis? The first thing we can write it over in terms of rheumatic heart disease. Rheumatic heart disease is the most common one. You have to remember any of this one. Now, what type of the thing we'll see in these cases? If I just draw the mitral valve over here. Okay, I am drawing the mitral valve over here. If we just draw the mitral valve, this is the annulus ring over here. This is the we get in between it what? We'll get these anterior leaflets. We'll get the posterior leaflets over here, for example. Okay, and this is the valve. This is the valve concepts. And hope you have already watched my video where I have already described the in details of the about the rheumatic heart disease. And we will see the formations of the vegetations. We will see the formations of the vegetations in between the concepts, just like this. Just like this, we will see the formation of the vegetations. Okay. Now, if we see the disease, if we see the frequent rheumatic heart disease, or if we see the frequent rheumatic fever, for example, then in these cases we will see there will be progressions of the word, there will be closure of the word, valve concepts over here. And for example, whenever we see this type of the problem, just like this, and whenever we see this type of the problem, then further process will start. That means whenever it will go under the healing process, and different types of the fibroblasts will come over here. Growth factors will come over here. As a result, this region that will be fibrotic. This region that will be what? Fibrotic. And whenever it will get converted into fibrotic, you know whatever the problem we'll see over here. Okay. Now, under normal circumstances, if we just see the surface area of the mitral valve around 5 cm square. Now, whenever from 5 cm square, it will come around 4 cm square. It will be still asymptomatic. But when you are from 4 cm square, if you see it is coming under around 2 cm square, at the time the symptoms will appear. At the time symptoms will appear in these cases. And if we see that disease is getting progressing, if we see the progressions of the disease further, then if it comes around 1 cm square, then we will see the severe symptoms in these cases. We see the severe symptom. In this case, we will see the severe symptom. Now, this was the rheumatic heart disease cases. So, whatever the problem we'll see over here, there will be the vegetations. That these are the what? These are the vegetations. And whenever the vegetations will just they will just take the place within the valve leaflets. As a result, we will see there will be there will be closure of the valve leaflets. So valve leaflet is what? This is the concept of the valves where through which the through which the opening will be here. So there will be no chances for the blood flow. So this type of the problem we will see as far as the rheumatic heart disease is concerned. Okay. Now the next type of the problem we will see what are the other regions or etiologies. We can talk in terms of congenital. We can see in terms of the congenital, so the problem we can see. Number third, we can see in terms of the senile. Senile means whenever the valves they will get elder. Okay, whenever the valves their age will be like around more than 60 years, for example, we can say over here. Then there is a chances for this type of the problem. That means we can say the stenotic valve. Now, fourth type of the causes you can write it about, that is, for example, the carcinoid syndrome. Now, what is carcinoid syndrome? We have to know in details these things. Now, to know the carcinoid syndromes, actually we will get what? Carcinoid, that means we will get a tumor. We will get the tumor like things who are within the JT. Now, for these things, I have to use this part. Now see, if we see the GIT over here, in these cases we will see there is formations of tumor, okay, in these regions within the GIT. And whenever this type of the tumor will be here, they will release the different types of the what chemical products, biological products. You can see over also. There is a 5-hydroxytetraamine. They will release the histamine over here. They can also release in terms of bradykinin. Okay. Now whenever it will be released over here, then we know whatever the problem is further. Now see, through the portal circulation, if I want to show you, through the portal circulations, all these products, for example, these are the products. These products through the portal circulations, they will be sent to the liver. And whenever these products will come over here, just like this, the liver is having the capacity to destroy all these products. Okay. Now see, whatever the problem we'll see further over here, that if the disease progress for longer durations, okay, then these tumor that can by the metastatic process that can go over here, and we can see the formations of the new tumor, new primary tumor where within the liver over here, okay, within the liver. Now see, from here these biological products, there is a chance for the biological products to go where, for example, the liver is not able to completely destroy the all biological products, I mean the 5-HT, histamine and the bradykinin. Then what we'll see over here, let me show this color. Okay, so through this portion, through these regions, we will know that where they will go. They will be taken to the where inferior vena cava from here. So from here, from the inferior vena cava, they will go where lungs. There is chances to go to there is chances for to go where within the right heart. So whenever it will go to the right heart, then they will go. For example, if I just show you these regions, is the what we know there is the what endocardium. So whenever they will go around the endocardium in these regions, let me show over here, endocardium, and they can cause the valvular stenosis, where in terms of the tricuspid valve, tricuspid valvular stenosis, they can cause the problem over here. That's why in case of the carcinoid syndrome, the more chances for having the stenosis in terms of the what the tricuspid valve. In case of the bicuspid valve, I mean in the mitral valve, there is also chances but very less. For example, if I show you over here, let me show, okay, let me show from here. Okay. Now see, for example, here there is lungs, like this. So through the circulations, whenever the biological products, they will also reach over here. Let's for example, the biological products, they will come over here also, then they will cause the damage. And through the pulmonary circulation, they will come over where within the lungs. So whenever the lungs, they will come within the lungs. Within the lungs, they are having this specific enzyme. So these enzymes are having the capacity to destroy this type of the products. Okay, but sometimes we can see this type of the tumor that can develop within the lungs as well. So whenever this type of the develop, that will develop over here, just like the carcinoid tumor over here. So from here, just try to understand from the figure. From here, where they will go? See, from here through the venous circulations, this type of the products through the primary tumor as well as from these products, there is chances for these products or the tumors products over here to go within the left heart. Whenever they will go to the left heart, they can cause the mitral valve stenosis. That means definitely they will go to the wire within the, for example, if I show you over here, they will go within the endocardium, and whenever they will go within the endocardial layers over here, just like this, they will come over here and they will cause this type of stenosis over here also. So they can cause ultimately the mitral valve stenosis. So these are all about the causes and what type of the things we can see. In the next part of the video, we'll see the further mechanisms and what type of the treatment we can do in these cases. Now see this type of the thing, we can see like in terms of around from the, okay, let me show over here, around from 15 to 25 years in this age group we can see this type of thing. Now in underdeveloped country, in underdeveloped or the poor country, we can see these cases more, because this at the time whenever we will see in the underdeveloped country the symptoms will come around 15 to 25 years, because in these cases in these countries we will see there is not proper treatment. So that's why this type of the symptoms will come, will appear first in the earlier symptoms we will see. But in terms of the developed country where the treatment is good, okay, in this country, in those countries we will not see this type of the thing. There we will see the symptoms but later. Why? Because in those countries you will see they will just give the good prophylaxis in terms of the antibiotics over here definitely. So whenever they will use the good prophylaxis, I mean the antibiotics, then this type of the things, the symptoms, they will appear later. So that's all the thing about this one. So hope you understood the positive agents and how these things are occurring over there. So I'll see you in the next video about its treatment and how can you prevent these things. Okay, so don't forget to subscribe.